Namaskar, welcome all of you to Quantum Institute of Photobiomodulation. Myself, Dr. M. Rakesh Kumar, founder of Quantum Institute, welcomes all of you. Today, I will present you about the blueprint of photobiomodulation training. Means here we will explain not only the photobiomodulation but also how to implement photobiomodulation in your career. What will be its blueprint? So now I am sharing it with you all by Quantum Institute of Photobiomodulation, a light towards life. Here we introduce with photobiomodulation. Photo means light, bio means life or living cells. Modulation means optimization, means using its maximum efficiency to complete its physiological activity. Therapy means implementation of these or any treatment technique to treat some pathological or accidental condition is called therapy. We start with history. Since 1400 BC, ancient Egypt, Greece, Rome, and India, some written scripts have been found. The sunlight was believed to speed up the healing and strengthen the body activity. Napoleon's physicians observed soldiers' ulcers healed faster after sun exposure. These are some initial steps. Niels Svensson, founder of modern phototherapy, developed ultraviolet lamps to treat lupus vulgaris and red light for smallpox scars. And for this, Neil Svensson was awarded with Nobel Prize. PUVA therapy since 1974 marked a significant advancement in treatment of psoriasis and recent advancements if we look after 1980s to 20 to 25. PBMT expanded to neonatology, psychiatry, and ophthalmology. Here, the key developments are Isaac Newton's light composed of different wavelengths laying foundation for light therapies. Downs and Blunt in 1877, sunlight could inhibit bacterial growth. William Henry developed ultraviolet bulb light to treat psoriasis. Extracorporeal photophorosis in 1987, helpful in treating cutaneous T cells lymphoma. Photodynamic therapy used in dermato-oncology. Development of laser and photobiomodulation. Max Planck, the father of quantum mechanics in 1900, he described the relationship between energy and frequency of radiations. Energy could be emitted and absorbed only in small size quanta. In 1905, Einstein photoelectric effect. Light also delivers its energy in quantum particles called photons. Einstein was the person who introduced the energy with particle size, the wavelength with photons which have a certain energy in it. So electromagnetic calculations could be made upon that two theories, one with Max Planck's invention and second is addition of Einstein. In 1917, Einstein proposed a theory of artificial emission, the process that makes laser possible. Whatever we have now is because of that theory, what was being proposed by Einstein. In 1960, Theodore H. Myman invented the laser, and because of that, we could separately use different wavelengths to perform different activities on human cells. Like what is photobiomodulation? Photobiomodulation involves applying low energy light. That is why it is also called low level laser therapy as well as cold laser therapy. Often we use LED devices, light emitting diodes, or lasers to target the tissues. PBMT is a non invasive light based therapy. uses specific wavelength of light from visible to near infrared, enhance healing, pain management, and tissue regeneration. How does it work? Light absorbed by chromophores of the mitochondria of cell leads to initiation of photochemical and photophysical effects, trigger a cascade of cellular reactions, increased ATP, reactive oxygen species, and nitric oxide. The mechanism of laser therapy, how it works on tissues, is been explained in this figure. You can go through it. Like we are using a wavelength of 670 nanometers, 808 nanometer or 94 nanometer is delivered to tissue via probe in contact mode or in the scanning mode. Nowadays, scanning lasers are also available. The light enters the cell mitochondria and is absorbed by the chromophores, including the protein chromosome C oxidase, which then increases its activity. As a result of this heightened activity, three molecules are affected. First, ATP, second, ROS, third, NO. Here, ATP is the main energy source for the majority of cellular functions, increase the cell's availability to fight infections, accelerate healing process. Second is ROS. The modulation of ROS activity activates transcription, means formation of mRNA, factors possible impacting cellular repair and healing. The release of nitric oxide, a potent vasodilator, increases the circulation around the tissue we are projecting the laser lights, decreases inflammation, and increase the transport of oxygen and immune cells throughout the tissue. Due to this process, the healing process of the photobiomodulation is heightened up. Means whatever the process that takes at least 1 or 2 weeks could be completed in 2 to 3 days. What are the benefits by this? First, alleviation of pain. Since it have a anti-inflammatory effect, the pain is getting alleviated. Immunomodulation. By doing so, we can control the autoimmune diseases. We can produce immune booster effect against bacterial or viral infections. Promotion of wound healing, tissue regeneration, selective cellular proliferation. This is a mind-blowing effect of PBMT, as selective cellular proliferation could help it to control oncological aspect, means spread of metastasis of tumor cells. Anti-aging effect, anti-inflammatory effect, antibacterial, antiviral effect. By all these effects, we have certain advantages, like it produces negligible side effect, reduces restoration time after injury, increases effectiveness of the medicine. Means nowadays the medicine or drug resistant pathogens are on the highest level. So by adding PBMT in our traditional pathy, we increase the effectiveness of our medicines, decrease post-operative complications. There are certain complications like the wound healing, increased number of diabetes patients, scar formation, infection. If the patient is limited to the antibiotic effect of the medicines, then we need photobiolation to improve or enhance the post-operative care. Very easy to operate, kids accept it as it produces no irritation or sensory impact. Means it is free of heat, free of any electrical samples, no irritation. Kids love it. Reduces scar formation after the surgery or any injury, improves immune system. Now we have to go through the tissue interaction. Here I am using the laser as a photobiomodulation initiator and how it reacts. It produces a certain thermal effect to nerve conduction and capillary dilation. Biochemical reactions include release of nitric oxide, ATP production, increased fibroblast migration, increased macrophage activity, increased keratinocyte activity, increased RNA and DNA synthesis, increases enzyme production, increases SOD production. Its bioenergetic effects could help in acupressure of meridian points by stimulating it. Bioelectric effect, electromotive action acting on membrane bond ion channels helps to conduct the transport across the cell membrane. Second, intracellular and extracellular ion gradient changes. By doing so, different medicines or the nutrition which are present in the plasma of the blood could enter the cell and helps to regenerate and restore its natural health. How it could be helpful in clinical practice? It reduces spasm, pain relief, increased circulation, improved flexibility and function, improved healing, reduced symptoms associated with osteoarthritis like diseases. Now we are moving on role of PBMT. The topic of the day, how it could be helpful in different medical aspects like surgery, medicine, Ayurveda, homeopathy, and physiotherapy. Here I am explaining how it could be helpful in surgery. In the surgery, there are two aspects. First is the preconditioning phase. Photobiolation can be used in preconditioning phase where it helps to prepare the tissues or the organ to further surgery. Means MPTP formation has been inhibited so that during the surgery, no cell death could be performed. In the field of medicine, it helps to optimize the effect of cells against the medicine, and by doing so, the medicine could work properly, appropriately over the organs. Like, for example, if most of the medicines getting activated in the liver sites during the in the hepatocytes. Here, hepatocytes activate it to produce the medicinal effect, which we read in pharmacodynamics. Photobiomodulation stimulates that. By producing lever modulation effect, we could enhance the efficacy of antibiotics, different thermodynamic medicines, and metabolic changes. The same way, if we use it with Ayurvedic procedures like Shirodhara or Panchkarmas and all, just think if we use BBMT supracranial activity above the skull and use Shirodhara with it. Whatever the results we are receiving after 15 days of Shirodhara could be achieved in 2 days. Yes, you are right. You are hearing the right thing that the results could be achieved in very shorter time duration. Same could happen with homeopathy. Homeopathy is working on energy level of whole body. And if we add PVMT to it, the organs responsible for stabilizing the homeostate of our body could be helpful, could reduce the treatment duration time. Physiotherapy. Physiotherapy, now we think that orthopedics is the only branch of physiotherapy. No, it is not. Orthopedics, neurology, cardiac, respiratory, ops and gynae, sports, geriatric care, pediatrics, all are part of physiotherapy. PBMT is helpful in every aspect, even in ops and gynae, where it is helpful to control PCOS, ovarian cyst, vaginitis, cervicitis, post-ops conditions. All this all together are available by using implementing photobiomodulation to your stream. So how could you implement it? First, you have to go through the fundamental steps of photobiomodulation. Second, disease specific effects. Third, implementation in your workshop. I'm just explaining it. In the fundamentals, we go through the characteristics of laser and photobiomodulation, its parameters, how deep it could go inside the skin, that is its penetration power, its mechanism over the molecular, cellular, as well as tissue level, step by step. It's very important, huh? Don't miss. And the biphasic dose response. Biphasic dose response is the very essential part before you implement it over any patient, because it not always go like this. Sometimes it go up and then means up to certain dose it produces a stimulation effect, whereas after attaining some dosage it produces an inhibitory effect, means you could generate both of it. That is why it is called biphasic dose response. In disease specific, we will go through human muscle tissue for better sports performance, bone studies and clinical application, how it should be applied over the fracture condition or post-operative condition because it is safer over the implants. Dermatology and aesthetic medicine application, treatment of pain, its clinical applications, PBMT in neurological disorders, orthopedic conditions, cardiac condition and peripheral circulation, OBS and gynae, dental conditions, hematology, psychiatric disorder, metabolic and endocrine disorders, and many more. It's like an ocean of knowledge. Whatever you learn, it's less. You will find that if you have some more knowledge, it will be beneficial. So, our call to action will be learn more, implement more, earn more. Once again, learn more, implement more, earn more. So, if you want to do so, just like this channel, subscribe the channel, and if you want to add on to Quantum Institute of Photobiomodulation, you can log in QIPT.in. Once again, QIPT, Quantum Institute of Photobiomodulation Therapy.in. Okay. Thank you so much for your time duration. Have a good day.